Hi everyone, and welcome back to Dr. Emily Cares. Today, we're tackling a crucial women's health topic that doesn't always get enough attention: bone health during and after menopause. If you're over 40 and thinking about how menopause may affect your body, especially your bones, this video is for you. Why menopause affects bone health. Bone health is something we rarely think about until problems start. But did you know that women can lose up to 20% of their bone density in the first 5 to 7 years after menopause? That's because estrogen, a hormone that plays a vital role in maintaining bone strength, decreases sharply during menopause. As a result, bones can become more porous, brittle, and prone to fractures, a condition known as osteoporosis. Signs and risks of bone loss. Most women don't feel bone loss happening. It's often called a silent condition, but there are warning signs and risk factors to look out for: loss of height over time, back pain or stooped posture, frequent fractures from minor falls, family history of osteoporosis, low intake of calcium or vitamin D. The good news is, there's a lot you can do to protect your bones starting today. Tips to maintain healthy bones. 1. Increase calcium-rich foods. Calcium is the foundation of strong bones. Aim for 1,000 to 100 milligrams per day after age 50. Include foods like low-fat dairy, leafy greens, almonds, and tofu. 2. Get enough vitamin D. Your body needs vitamin D to absorb calcium. Spend 10 to 15 minutes in sunlight daily or consider a supplement after checking with your doctor. 3. Weight-bearing exercises. Walking, jogging, dancing, and resistance training help build and maintain bone strength. Aim for at least 30 minutes, 5 times a week. 4. Avoid smoking and limit alcohol. These both accelerate bone loss. Cutting back will not only protect your bones but also improve your overall health. 5. Bone density testing. Talk to your doctor about getting a DEXA scan, especially if you're over 65 or have risk factors. Early detection helps in early prevention. 6. Consider medical options. Some women benefit from medications or hormone therapy to protect bone health. It's always worth discussing with your healthcare provider. Remember, menopause is a natural part of life, but bone loss doesn't have to be. With the right steps, you can keep your bones strong and stay active, independent, and pain-free well into your later years. Thanks for watching. If this video helped you understand menopause and bone health better, please give it a like, subscribe, and share it with other women who might benefit. And don't forget to comment below. What's one thing you're doing today to take care of your bones? Until next time, stay strong, stay informed, and stay well.